I'm Gill and I'm a PhD student at the University of Manchester. I'm supervised by Professor Chris Armitage, Professor Dawn Dowding and Dr. Dharman Jayasingam. My PhD project explores social workers' implementation of national guidelines on self-harm with children in care. We know that children in care are at increased risk of self-harm, with studies indicating risk rates between 2 and 4-fold higher than children who are not looked after by their local authorities. The assessment and management of self-harm in children in care is an under-researched area. Guidelines on the assessment and management and prevention of recurrence of self-harm published by the National Institute for Health and Care Excellence apply to all professionals working with adults and children who self-harm. The guidelines aim to improve the quality of care of individuals in all settings and services, including children who are looked after, using the best practice and evidence available. With rising rates of child self-harm and increased numbers of children entering the care system, they offer the potential for improved physical and mental health outcomes. However, we know that professional awareness of guidelines can be low, which can limit their impact. My project has 4 main phases. I have completed the first phase with a rapid systematic review of the literature on health and social care professionals' awareness and implementation of NICE guidelines on self-harm. Low awareness and implementation rates were found amongst healthcare professionals, and the results are supported by the wider research literature demonstrating poor professional awareness of government policy and guidelines. Key barriers to implementation include lack of staff training, negative staff attitudes towards self-harm, and time constraints and lack of resources. Adherence to NICE guidelines on self-harm is an under-researched area. The absence of studies beyond the health sector and exploration of awareness and implementation of the guidelines on self-harm in children is a key limitation. The findings of a rapid review form the development of the project's research questions. We seek to determine what proportion of children's social workers in England are aware of the NICE guidelines on self-harm and what proportion are implementing them with children in care. And we want to know what are the barriers and facilitators to their implementation. I'm now in the second phase of the project and have submitted an ethics proposal to conduct a large-scale online quantitative survey of children's social workers' awareness and implementation of the NICE guideline on self-harm with children who are looked after. Future plans for the project involve the third and fourth phases of the research, which I will work on over the next 2 years. In the third phase, I will interview social workers of children in care who self-harm, who are aware of the NICE guidelines, to gain rich insights into the barriers and facilitators to implementing them with children who are looked after. Data will be analysed using a framework for behaviour change, and in preparation for this phase, I have completed training on NVivo and behaviour change interventions. In the fourth phase of the research, the findings will be used by care experienced young people and social workers to work together to co-produce a behaviour change intervention that will hopefully increase social workers' use of the NICE guidelines. In preparation for this phase, I have completed training in co-production and participatory research. I presented my project plan at a conference, and I shall be presenting my rapid systematic review in a webinar later this year. If you want to find out more, feel free to email me at jill.lever@postgrad.manchester.ac.uk. Thank you for listening, and I hope you enjoy the rest of the day.